Hello, everybody. My name is Michelle Stover Wright. I'm with the BUILD Initiative, and we are very excited to host this webinar on behalf of the Early Learning Challenge Collaborative, which is a partnership of BUILD and the First 5 Years Fund. This webinar today is titled Children with High Needs and Early Learning Challenge, Opportunities to Develop High-Quality Plans to Close Gaps in Educational Outcomes. The Early Learning Challenge Collaborative was created in part by the eagerness of private funders to support this opportunity for increased federal investment. It started in 2011. The collaborative was clear that it had several goals, which include supporting states that seek to apply for, implement, and document outcomes to the Early Learning Challenge. BUILD's role in the ELCC is to coordinate technical assistance and learning community activities. This webinar is one in a series of webinars geared toward the round 3 applicants, so welcome. We are very excited. We have over 15 states registered for this webinar, so we look forward to good conversation and learning a lot from you and learning a lot from our experts. At the end of the PowerPoint, I will say a little bit more about the Early Learning Challenge Collaborative, including announcing some future webinars and letting you know about the technical assistance that is available to your state as you work on preparing your application. Although most of the materials on the site were developed for round 1, there is a new updated version of the planning template, and a lot of resources developed earlier will be just as helpful for round 3. The website address is on the last slide of the PowerPoint, and we will also email you the PowerPoint and post it right after the call. On some logistical fronts, all of you, well, and this isn't actually true, you are not muted, and we ask you to kind of keep things quiet or mute your own phone just so that we can make sure to hear the presenters clearly. If you have a question, we ask you during the time that we open it up to questions to unmute yourself and please ask the question. You can also, if you look on your screen, you'll see a little thing where you can raise a hand, and if I see your hand being raised, I can call on you during those open times for questions. And last, you can also write your question in the chat box, and when it seems appropriate, one of us will read the question, and we'll ask the presenters to reply. So with all that out of the way, why don't we begin our presentation. We are talking today about children with high needs, and clearly, as you all know, the central priority area in the Race to the Top opportunity demands attention in every area of this application to address this really important issue. And we are really pleased to have 3 experts on the Race to the Top opportunity and its focus on high needs children on this webinar and to share their thoughts and their insights into this opportunity. First, we have Miriam Calderón. She is a senior partner at School Readiness Consulting. She works as a consultant for the BUILD Initiative, and she also was most recently was a political appointee in the Obama administration advising on early learning policy. Charlie Bruner is our National Director of Research and Evaluation for the BUILD Initiative and has written extensively around high needs children. And Sherri Killins is a former commissioner of the Early Education and Care for the Commonwealth of Massachusetts, and she currently serves as a consultant to BUILD. It was really through her leadership that Massachusetts wrote a successful application, so we're excited to have all 3 of them on board. Let's see, go to the next slide. Great, thank you. I'm just going to talk briefly about the structure for the presentation and what you can expect to hear. First, we will kind of talk about the federal focus for the Early Learning Challenge and around children with high needs, what those guidelines are, and the definition of children with high needs. It's used in the Race to the Top. Presentations around the research and knowledge base on children with high needs. What do we know? What does that mean? What does the research tell us? We'll talk about incorporating that research and knowledge base into your state application. And then finally, we'll have a kind of a disclaimer and some offer for help from Early Learning Challenge around this high needs topic in relation to your Race to the Top application. All right, so first I'd like to lead off with Miriam, who's going to talk a little bit about the federal approach for the Race to the Top in relation to high needs children.
Great. Thank you, Michelle. Good afternoon, everyone. So I'm going to start by discussing the federal intent and the emphasis on children with high needs. As you all know, putting a credible plan together and an ambitious plan for closing the school readiness gap is the overarching absolute priority of the competition. As some of you might have heard through some of the technical assistance that the department has been providing, the departments including yesterday's session, the department is, and the intention of the administration is to think about all of the linkages between all aspects of your plan and how those relate to closing gaps for children with high needs. This is as you know, you'll be evaluated for whether or not you meet this overarching priority, and the way in which the departments intend to sort of evaluate that is both looking at how you define children with high needs and how in all of the various high-quality plans you put together, how those children are referenced and mentioned, and the extent to which there are very targeted and specific strategies that will close the gaps. So you'll see on the next slide, there are many references to children with high needs throughout the application, again, as well as throughout all of the efforts that you'll discuss within your high-quality plans and the focused investment areas. The application on the next slide you'll see also makes specific references to certain populations and special populations of children, subgroups, children with disabilities, English language learners, migrant, homeless, and foster children, children from low-income families, as specific subgroups of children with high needs. But what is really critically important to emphasize here is the fact that the state will define and has room to define this category or population of children with high needs based on other information and data that the state is collecting. And I think what's critical here is to really leverage that opportunity and have a working understanding of who these children are, and then be able to weave them into your narrative and your plan for how you will specifically be able to close the gaps for these children.
Great. Thank you very much, Miriam. I think we are, and one of we really intend for this webinar to be interactive. So every once in a while, we kind of want to get some feedback from you and hear about some of your plans. And I think we're going to do that. Next, do a poll. And Megan, oh, there we go. All right. So if you'll see in front of you that there is a question, and the question is, how are you thinking about defining children with high needs in your state application? So based on where you are now in your planning and your work, kind of what's your plan for addressing high needs and your option? And so we'd like you to pick one of these. Is your state planning to just use the federal definition as it's laid out in the application? Are you going to use the federal definition, but you may add in just a few wrinkles of your own, maybe speak to specific populations in various sections? Are you planning to plan major, but be a major kind of different and be a little more nuanced in your emphasis? For example, focusing maybe on developmental risk, family stress, neighborhoods, or have you really not decided and that's why you're here? So if you could kind of take a look at those responses and pick one response, and then we'll move on with the presentation.
And folks, just a reminder, if you could mute your lines using *6, that would be great.
All right, we'll give everyone just a few more seconds to respond to the poll. Okay, Megan, then do I close it?
I'll take care of it, Michelle.
Great, thank you. All right, well, it looks like we have folks that are, for the most part, in two categories, that you haven't really decided and you want to learn more on this webinar, which is great, and I hope we can provide some information for you. Or also you're kind of sticking fairly close to the federal definition, but really trying to make it your own and have it integrated, a slightly broader definition integrated into your work. So thank you very much. I think that's helpful for us. All right, so our next presenter is Charlie Bruner, who is going to start talking about a little of the research around high needs children in relation to this opportunity.
Well, thank you, Michelle, and I'm glad to see your responses and particularly your interest in the in this webinar. And I'm going back to the federal definition because I think that as one looks at the federal definition, it's sort of like, isn't there everything that we'd want to have in a definition of children with high needs already there? Low-income families, children who have disabilities or developmental delays, English language learners residing on Indian lands who are migrant, homeless, or in foster care, and other children as identified by the state, because that certainly is a very broad array of children in the state. And we're not talking about eliminating any of those categories, but we are going to look at how in developing a proposal can draw and better focus some of your work and attention to particular parts of that high need population. One of the challenges that we will find is that the federal definition, particularly that low-income category, when it applies to young children, covers a very broad number of children in the country. In fact, 48% of all kids 0 to 5 live in households that are below 200% of poverty, and that varies from 31% in Massachusetts to 60% in Mississippi, so there's fairly large variation across the states, but still it's nearly half of all kids. And then when one looks at children who might fit the other category in being above 200% of poverty, primarily kids with recognized developmental disabilities, delays, that may be another 6% of the population. We're talking about 54% of all kids being defined as high needs. And certainly those kids have needs, but when we're looking at programs and strategies that may be reaching a far smaller number than 54%, it's important to be able to identify and respond to those who are most at risk. What's included in the federal definition are, and particularly the definition around 200% of poverty, is that 19-year-old mother who dropped out of 10th grade and is already 2 grades behind with her 8-month-old, who I think most people would see as clearly being in the category of a child with high needs because of the social and economic conditions surrounding her. But also a couple with a 2-year-old living in married student housing and starting out at the beginning of their career falls into that category of below 200% of poverty. And it may or may not be that a master's degree just divorced 27-year-old mother of a 2- and 5-year-old leaving an abusive relationship would fall into that category. These are 3 different families, and they have very different types of needs and very different opportunities to respond, and particularly when we're trying to close the gap in results, that second family is probably not the one that we want to focus our primary attention upon. And the third family may well be one that we have concerns about, but may not need economic supports and may be able to derive from her own situation a way of dealing with the early childhood adversity that her family is facing. So what's included in the federal definition is not very discerning when it comes down to actually deciding what families and kids should be focused upon when one is trying to design specific high-quality programs. And remembering in the federal definition of high-quality programs, those include formal early childhood programs, but they also include Part C services, and could include home visiting and other services that can support children in their development. So we believe that there's a value in greater differentiation as people move forward in their applications regarding children with high needs. And one of the reasons, which I stated before, is that many or most programs that are designed to address children with high needs right now do not reach or serve nearly 1/2 of the population of young children. And if we're going to work with those programs, we want to make sure if they're serving 1/4 of the children or 1/10 of the children, that they're not serving those children at the very top level or the very low level of the need category, like that graduate school couple. And I think that's compounded by the fact that we know the young children and family with the greatest likelihood of program need often are that way because of their own stressing conditions, their access to and a connection with services, their social isolation. So those that may most need and benefit from services are least likely to be first in line for services. And finally, when we're looking at any type of definition, the broader the definition of high need, the greater the challenge in developing preventive services, which are always subject to some over and some under identification. So one of the things that we would recommend looking at is looking at the federal definition as a starting point, but then being clear that in some instances, and particularly around certain types of programs that are going to be developed to close the gap in results, are going to be additional categories or factors to be taken into account in ensuring that the programs really reach those children at high need. What the research and knowledge base on children with high needs points to is that for young children in particular, maternal education is actually a better predictor than income of future success, particularly because families starting out when they have young kids are at the beginning of their careers, at lower wages, and have the least amount of time to spend on their jobs because they're providing care. So that 200% of poverty covers a lot of people who are not really, I mean, they can benefit from services and supports as we all can, but their kids are not at particular risk of not starting school healthy and prepared for success. Maternal education is a better indicator of what the longer-term prognosis is for children. We also know that geography and neighborhood play a significant role, that whether or not there are resources, services, support, role models, mentors, activities, high-quality schools and other environments often are related to the geography, and no matter what the family income, where they live is going to impact what they have available around them. And third, and particularly important, is really if you look at the individual family and circumstances and what we know are correlates or the essentials for healthy growth and development, it's much less around public services than it is the types of social determinants, the absence of protective factors as they're presented in the strengthening families network, the likelihood of early childhood adversity, which can easily lead to toxic stress, the home environment being one which provides that consistent support, and a number of social determinants which really relate to where the family is. And we're going to speak more about two-generation approaches as we go forward, but really it's not an identification of something that's with the child, but it's really the the family as their child's first and most important teacher, nurse, safety officer, guide, transportation aid, and so forth. That's really important. We also know that some children have specific stressors or vulnerabilities, developmental disabilities or delay, mental behavioral conditions or physical disabilities, or living in ways that they are discriminated or marginalized or their families are, and that these need responses in their own right, but they also can contribute to the child not being part of regular normative developmental activities. So those child-specific vulnerabilities also are things that need to be addressed. And the federal definition does talk about developmental disabilities or delays, whether that also gets into physical disabilities that can limit behavior and contact, and mental health conditions is a little bit unclear, but certainly those ought to be considered. And finally, race, language, immigration status, and what can be a mismatch between how systems respond and whether there exists structural or institutional racism can really be a factor that creates high needs for kids and a need for some different type of response, that we really do practice inclusion rather than discrimination. Earlier there was a slide that showed that the federal guidelines stated the terms children with high needs 84 times. They used the word cultural 6 times, and they used the term race as it applies, not to race to the top, which they used a lot, but as they applied to race or ethnicity 3 times. So largely in the federal guidelines, there's a little bit of reference to race and a little bit of request for data to break down by race, and some around language, but there's not a lot in the actual guidelines that say you have to deal with these issues in your application, as there certainly is with children with high needs.
Hey, can I just interrupt for try? Could I remind all the participants to please mute your lines when you...
Actually, I'm going to go ahead and hard mute everyone just because we do have some background noise that's been sticking with us for a while. So presenters...
The conference has been muted.
Presenters, if you could unmute yourself manually using *7 when you're presenting, that would be great. Thanks.
So thank you. So that research and knowledge base really is there around a number of ways of looking at what create for child vulnerabilities, largely that do go beyond what the existing federal definition of children with high needs is in the guidelines. And I put up this slide, I think that partially because we have this available for all 50 states as well, but I think it also does point, as I said, if you want to look demographically about what are the best indicators for success and look at maternal education, you really do see that there are a very significant number of mothers of young children who are in that limited educational background of a high school diploma or less that are going to be particularly important to identify for activities, and particularly for folks who deal with family engagement and deal with other services around home visiting, show how they're connected. I think that that's important. The last slide I want to present on the research is really the international research, which looks at the social determinants of healthy child development, and really draws from a tremendous amount of national and cross-national research on what it takes to ensure the healthy development of children, and speaks to 10 factors. And the 4 I'm highlighting here 5 I'm highlighting here I think are particularly important: the social gradient, the relative status of people in the overall society. And the more there is inequality and there's more that there is a social gradient that blocks opportunities for advancement or perceived advancement from the bottom sectors of society socioeconomically, the poorer the child health, the more stress that exists, the less that there are experiences in early life that are supportive and nurturing, the more that there is social exclusion and a sense that certain individuals, groups, classes of people are not included in activities and discriminated against, produces poorer health, and the absence of social supports and networks that really do contribute to overall well-being. All of those elements are things I think that as we develop high-quality early learning systems and try to respond to children with high needs, there is a need to look at what are we doing to make sure that those social determinants don't exist or that we respond in some way. And again, this language is from the health world and from a huge amount of health research on healthy development. It's very much aligned with the resiliency literature and the risk and protective factor literature that points to what makes a child vulnerable and growing up in a situation of high need. And finally, we're going to speak more about the importance of employing a racial, ethnic, and cultural lens in this work, not because the color of one's skins or the belief system or the patterns of affiliation with other groups place people at risk, but in and of themselves, but in working in a dominant culture when you're not part of that culture, you certainly are vulnerable if you are not included, if you're not valued and recognized, and if you're marginalized. And one of the things I always say is America is becoming more diverse and young children are leading the way, and this slide presents this data for the United States as a whole. And again, this is data that any state can produce for itself, and it shows that for our young child population today, 49% of all kids are Hispanic or of color. And by the year 2016 or 17, there will be no majority group of by race of young children. I think that's already occurred in terms of births. And it remains high at 6 to 17. When you look at the adult workforce, it is 35%, and at 65 years and older, which I count myself among, it's 20%, that children really are leading the way in diversity, and our society is becoming more diverse, and it's obviously how we respond to those children in ways that maximize their potential that's going to lead us to be a prosperous society in the future. And I bring out at the bottom, and again, you can gather some of this information at the state level, when you look at those people who are most in contact with young children or children, healthcare practitioner community is only about 25% of color, and a very significant share of that is Asian, and as you see, a very small percentage Hispanic, and elementary middle school teachers are about 20% of color. That doesn't mean that they can't be great role models and educators for the kids in their classrooms, but we do have to recognize that we have a need to address and develop culturally competent and responsive systems if we're going to respond to all those kids in that 0 to 5 and 6 to 17 age bracket who are of color. They have to see role models and responses that show that they have an opportunity to succeed. So in summary, and I'll bring in the last slide, which I borrowed from Neil Halfon at the University of UCLA Center for Healthier Children, is what are the current range of child needs? And this is from a health and development perspective. We know that 2 to 4% of all kids have child-specific severe disabilities, which may be spinal bifida, it may be severe autism, it may be a variety of physical health conditions, but we know those, and we generally have identified those children and are working with them. We know 10 to 14% have diagnosable special health care needs, which relate both to developmental disabilities and mental health concerns. We do a much less good job of identifying and responding to that population, but those are children with high needs because they have certain conditions that require special attention and probably place their families at stress. And we have 30 to 40% of families which their child and family situation is likely to compromise their behavioral, developmental, and learning concerns. And while we need high-quality early childhood programs that work with children, to get to that 30 to 40% of the population, we have to do things that also strengthen and support that family. So in conclusion, I guess that my top-line findings from this discussion around children with high needs and what the research says is that income as a description of children with high needs really only gets at a part of the risk children face. Income clearly is most applicable to affordability of high-quality early childhood programs, and anyone who has incomes below 200% of poverty and has a couple of preschool kids is likely to be struggling to be able to afford high-quality care unless they can run across it by good luck and good fortune, because there's just a mismatch between income levels and what it costs to provide that care. So it is very applicable when we're looking at early childhood programs. But income is really insufficient to respond to other issues related to children with high needs. And those are family factors and conditions which really do relate to neighborhood as well as family, to early responses to those special child needs that we respond when children are very young, and an ounce of early intervention is certainly worth a pound of remediation and compensatory services. And that we address social exclusion, institutional and structural discrimination or racism to ensure that kids really and their families do see that they do have opportunities for themselves in our society. So those are the top-line findings that I would present on why the federal definition is okay as far as it goes, but if we want to get at closing gaps across the spectrum of young children, we're going to have to take a more nuanced perspective and do different things and provide different supports for different groups of young children and their families.
Thank you very much, Charlie. I think the next section of our webinar will be another polling question. Thanks, Megan. So this question now, kind of based on what you've heard and the research that you've heard around high needs over the last half hour, what do you think about, what do you think now about your state and how they should define high risk? You can respond that it hasn't really changed. Maybe you plan to go in a little bit more detail than what you were previous in defining high needs or rethinking how it fits into high-quality planning in different sections. You still really want to know more, or you want more specific ideas on how to define high needs within the Early Learning Challenge Race to the Top application. So I'll give you a few moments to respond to this poll. I'll give it about a few more seconds. Thank you. Megan, I think we're, there you go. Thank you. Well, it looks like we have responses across the board. About a third hasn't really changed that much. Some are planning to go into some more detail based on kind of what you've heard and the various options that there are. Several of you still want to know more, and I think, and this is good, want more specific ideas of what that might look like, which I really think lends us to what we're going to do for the rest of the webinar. We're talking more specifically about this topic in relation to the application and what that looks like. What we're going to do now is we're going to ask Miriam and Sherri to briefly comment on what they've heard so far around the research and the defining of high needs children within the race to the top. And then we're going to open it up for questions. So I'd like people to start thinking about what questions you'd like to ask verbally. You can *7 on your phone so that you can ask a question. You can also type it in to the chat box on the left-hand side of your screen, or you can raise your hand and I can call on you during the open question portion of the webinar. So I think first I'm going to ask Miriam if she could respond to the first part of our webinar.
Great. Thank you, Michelle, and thank you, Charlie. You know, I agree, and I think Charlie has really put a lot of very useful and provocative information to help really ultimately challenge, you know, folks that as they think about these plans to move beyond the federal definition. You know, as you think about the way the federal definition is defined in the application, I think about the extent to which special populations are mentioned, data about those children and information that the state has is required, and clearly, you know, on one level, a bar in terms of meeting that is to be able to talk about these children throughout your plan. I think it is another sort of level of sort of ambition and intention to take that information and then use other information that you have, some of which Charlie has given a sense for, to define sort of a greater level of need within those very broad categories of kids, and really ultimately be able to say, I know who the highest risk kids are in my state within those categories and potentially some others. And you know, as we've stated, the federal definition gives you room to do that and say, I know who these kids are, I know where they are, I have very concrete ideas and strategies about how I'm going to focus my efforts and be able to close school readiness gaps for those children. And essentially, really, how am I going to up my game and with respect to an identifiable group of high needs children that I am tracking and that I am focused on in all of the various work that I'm going to be implementing as a part of this plan.
Thanks, Miriam. This is Sherri Killins, and as you build your early childhood system for all children, understanding your high needs children is critical in making your work targeted to those with the highest chance of developmental delay. There was a question raised as people registered for the workshop, how can we identify and respond to children with high needs? Well, this is your opportunity to link access, screening, assessment, and family engagement in your application, because that will help you have the data and information to create individualized responses. And while the focus is on high needs, and Charlie's mentioned that, that's why universal screening is so key, and working with medical homes and pediatricians as well as early child care programs, because the ability to locate and find those children that need other opportunities is also important. And your high needs definition helps you in creating a platform to work with other agencies, especially your state partners, because it brings them together around the children and families that they see. It allows you to go to your libraries and museums and your housing folks around homeless children and create a better understanding, a shared understanding of the work you're doing and the children they see in their space that could benefit. There was also a question about Head Start and Early Head Start and how does it fit in. And the MOU that is required between each Head Start program and the district has a section that talks about defining those children that are in most need of Head Start services. And that's a great place to start if that's been authentic work with the district, rolling those definitions up to the state, because often you are unable to serve all the children that both you and the district think need the support.
Thank you very much, Sherri. We are now going to open it up to questions, and we had a question that came in our chat feature, so I'm going to read that to our respondents. It says, living in a rural state, cultural and ethnic diversity is very limited to only a single region of the state. How can we ensure a thoughtful review of our application if this aspect of child risk is not a significant portion of our target populations and strategies? So I would invite any of our presenters today to respond.
Yeah, well, one of the things you're going to find whenever you look at rural communities, whether you had 1, 2, or 3 in Massachusetts, we had several, there's always going to be a limited number of children. And so going to those communities, understanding how they operate, what's their network, and despite the small number of children, if they're presenting with developmental delays, if they're not having access to resources and services, then working with that community to figure that out is critical. You're going to find issues of transportation. You may find additional alcoholism that people aren't able to get out of those communities. When you talk to the people who serve those families, they often can't get the center-based programs, so there's a lot of home-based going on because of the transportation issues even when they exist. But as I've discovered, if I go into those rural communities, they figured out a way of working within that community, and you build off of that. It's not about doing something new. It's about building off of that. Wherever their pediatric health care, may be one option.
Yeah, and as far as the question, maybe from states like Vermont and New Hampshire, that there are Maine, that there's not a lot of diversity, and I don't think that that's necessarily going to weigh against an application. I do still think that there is some diversity, and to the extent that that's identified, it's important to say how we're going to be responsive. I come from Iowa, and Iowa's also fairly homogenous to the extent that 96% of our seniors are white non-Hispanic, but 15% of our child population is, and there's been this growth, so it still is an issue that I think we can address. Moreover, there is a competitive preference priority, as you know, around rural approaches, and I think what Sherri said around universal screening and identifying what the needs are and contouring what you're going to do to the situations at hand, I think that that's key. We provide a lot of attention to the issues in this presentation around, and will more, around issues of race, language, and culture, because they really are big issues in most parts of the country. But we're really talking about how can we ensure that all children are included, and whatever their socioeconomic, racial, cultural background, or their that they feel that there are opportunities available to them.
Thank you, Charlie. The next person I'm going to call on and ask her to unmute by hitting *7 is Allison Richards. Do you have a question?
Yes, I do. Can you hear me?
Yep, we can hear you.
Thank you so much. I am from Vermont, so thank you for that those last comments. But my question was about the broad definition of high needs. And given the first presenter's comments, it does sound like we're talking more about differentiating within the broad federal definition, which is fascinating, and we certainly will do that in certain parts. But we had been talking more about whether we should make the definition more broad and including others. And it sounded like some states had even gone so far as to include all of their children in the definition. So I was just curious if you could elaborate a bit more. Sounds to me like the way to go would be differentiating, so to get sort of the finer thread within the Fed's definition. But I would like you just to comment on sort of the broad versus differentiation.
I was talking with a pediatrician friend, and he talked about, in the medical world, universal differentiation. And I think that there's a natural tendency for us to say that all children are at risk and vulnerable, and certainly absent parents and support systems, kids can't do it on their own. 2-year-olds don't walk into the doctor's office or into the preschool program and pick up their ties and make their meals for themselves. So there's something around, yes, all children are potentially at risk and vulnerable, but many have very strong support systems that are available to them. And as we think about what is our role as a society and in terms of public responses, where do we need to invest our resources, that's where I think that it is important to provide for that differentiation. And it ends up, in most instances, what we want to do is going to be a narrower set than exists in the broadest federal definition.
But as a state leader, you will have a tension as you try to get legislative support that you figure out what is available to all and then figure out what is targeted around this high needs piece. There's certainly a tension around making sure that all children have access to opportunity.
All right. Thank you, Charlie and Sherri. Other questions? If you have a question and would like to ask our presenters, please *7 and unmute yourself and go ahead. All right. Well, why don't we? I'll give you a few more beats in case you're trying to find *7 on your phone. All right. Well, I appreciate those insightful questions and the responses. I think we're going to move ahead to the next section of our webinar, which is a lot more about incorporating the research and the discussion that we've heard into that grant application, where our focus clearly is over the next month or so. Charlie.
Yeah, thanks. And I'm going to start this off, and then we're going to have a real live example of somebody who really did this successfully, and importantly in their first round application in 2011. But I've had the opportunity to read a lot of the 2011 applications and the other work, and clearly the application, you want to get awarded funding to do good things. So state applications did write to the test, and that test didn't necessarily have the types of nuances that we have talked about here. And in general, in the first round in 2011, most people used the default federal definition in applying, and Massachusetts was really a notable exception, and Sherri's going to speak to that. Some states did focus upon high-need communities and directed attention to those, and many states chose to write on family engagement, and that was where it was most common that people would talk about issues of race and ethnicity, because that was, frankly, the only place that the feds really said, we want to know something about what you're going to do around family engagement on race and ethnicity. So, in fact, in the first round, there was limited attention, but I think that there was enough to give us pointers on where that might occur. And I think that as people look forward to it, at least the advice that I would give, and with the disclaimer that this is not necessarily the way to score the most points, and we don't know, and that's up to the reviewers, but is really to start with an upfront discussion about why the application will take a differentiated approach to defining children with high needs, and say it's really going to try to look at gradations and ones that are focused on the particular circumstances of kids to also state the history and attention to addressing these issues, including the context and understanding of culturally, racially, and linguistically responsive services, to include additional data relevant to defining needs and vulnerability, including through a racial lens, and I'll provide just a little bit of information there. And then incorporation of the discussion of all the how sections, not limited to family engagement, of really how you're going to track to see that what you're doing is reaching those children with high needs and their families and really achieving what you want with them. This is a slide which, again, this is national data, but all of this data is available at the state level. And this is something to say if you want to try to put some type of racial lens or context, this shows white non-Hispanic population, African American, black population, and Hispanic population. And around issues of child poverty, clearly there are huge differences in that. So when you do define by poverty or low income, you're going to be serving a disproportionate number of African American and Hispanic kids, or should be serving them, simply by their characteristics. Their parental education levels and opportunities for advancement are very different. The likelihood of living in a single-parent family are very different. And the likelihood of there being young mothers and parents is very different. So the context in terms of what types of families and how you're going to respond may look very different in terms of these groups, which have their own, may have their own identity, perspective, and location in the state. In terms of family concerns and stressors, and this is taken from the National Child Health Survey, also they're more likely to live in poor and unsafe neighborhoods. They're more likely to report that the mother has poor or fair mental health, almost twice the rate of white non-Hispanics. And I think the literature is very clear on the relationship between maternal and parental depression and healthy child growth and development, in terms of stresses about parenting and in terms of concerns about children's development. So it's not just that the prevalence of these concerns exists in a much greater degree in these populations, but if we're going to respond to those populations, we have to do so in culturally and linguistically responsive ways. Several years ago, a working group for BUILD developed a framework around looking at issues of how can we close the gaps that people do speak about at the time of kindergarten entry related to children's readiness, and really concluded that we know from the data, and we can look at 3rd and 4th grade reading scores, and we can look at a variety of indicators. We can certainly look at wealth, parental income, justice system involvement, and see big disparities in terms of results for kids and families by race and ethnicity. But part of that is borne by a participation and access gap in formal services, and we have to give a lot of attention to, are we getting people from different cultural, linguistic, and racial backgrounds? Are they involved in, are they connected to health, preschool, and other developmental services? There can be a cultural awareness and responsiveness gap that are they being served by people who really do understand and value where they're coming from and know what their lives are about. There can be a workforce diversity gap, particularly among credentialed providers and degreed professionals, as was shown in the earlier slide, and how are we trying to build a workforce that's going to better reflect that population. And there can be a stakeholder planning and decision-making gap, particularly around developing public policies and recognizing the expertise of those from other backgrounds and experiences. And pointing to these participation, cultural awareness, diversity, and stakeholder planning and decision-making gaps, all of these relate to developing high-quality plans. And the process of developing the plans, in what you do with your workforce and what you do in terms of your quality rating and improvement systems, and what you do in terms of ensuring that your high-quality programs are really available and responsive to different groups. So I think that this framework can also be put into, this is how we're going to address and ensure that our strategies in early childhood do respond to racial, linguistic, and cultural diversity. The last slide that I'll present is just one on kind of place-based and looking at the fact that communities are very different, and where people live make a difference in what is available to kids regardless of their parental factors and what's available in their neighborhood. And of course, when kids are very young, they're most bounded by their neighborhood in terms of their interactions. And this shows, and it may be a little bit hard to read, but what my center did in 2000 around by census tract around the country to look at those with no vulnerability factors related to kids around health, education, and wealth, and social structure, and those with multiple factors. And in those with no vulnerability factors, about 1 in 5 families was a single-parent family, compared with over half in those high vulnerability neighborhoods. The percent of families with children in poverty was 6-fold greater in those neighborhoods. Those without a high school diploma, nearly half in those neighborhoods. And trying to think of a neighborhood where half of the adults don't have high school diplomas versus ones where 14% don't, there are huge differences. There's the least difference in terms of wage income. People are working in those poor neighborhoods and disinvested neighborhoods, but they're not working enough to sustain themselves. And the amount of resources that they have to invest in their families and themselves varies dramatically. These data, which again can be developed by state, can focus on where are our neighborhoods where we think we need to have strategies that go beyond looking at individual families to really creating community environments that are going to support healthy development. And the last two things on this slide is when you look at those census tracts which are high vulnerability versus no vulnerability, those with no vulnerability factors, 83% of the people are white, non-Hispanic. Those with 6 to 10 vulnerability factors, 83% are of color. That there is a lot of segregation by race, ethnicity into areas which are very disinvested and don't have a lot of resources. And then the final slide, the final thing is that these are also neighborhoods which are much younger and have very many more children. 0 to 4-year-olds as a percentage of the population is 6% in those non-vulnerable areas, but 9% in those high vulnerable areas. These are the neighborhoods where there are huge numbers of young children and are going to require special attention if we're going to succeed. And that's another way of incorporating into proposals something that can have a focus on how are we going to address children with high needs. So in summary, and really a segue to the next presentation, the more I think, to have a really an approach that is going to get at the heart of the needs, that you can incorporate discussion of racial, linguistic, cultural, and socioeconomic gaps, that you can identify the role of place and community. And a number of the first round proposals did devote resources to specific places and looked at high need areas. I think that that's a real potential here to learn and do and take a community building focus as well as an individual child focus, to recognize the need for two-generation approaches, and to involve multiple stakeholders and diverse leaders in planning and governance. And I think all of these are things that can be incorporated into the high-quality plans, and then also into the resources that are going to enable you to take steps with the funding to really address gaps. So I want to turn it over now to Sherri.
Thank you, Charlie. So in Massachusetts, it was really helpful at the state literacy of a definition of high needs, and we used data from the National Center for Children's Poverty, and I was able to, based on that data, definition that said about 135,000 children under 6, and the total population was about 450,000, had more than one risk factor, or at least one risk factor, and that 20,000 had 3 or more risk factors. And we know from what the earlier presentation had been and the data that's there that those children are likely to have a developmental delay and most likely to benefit from the kinds of supports we want to give them. And when we thought about what the definition was, and this was discussed by the board in Massachusetts as well as the staff, we modified a little the definition that was given by the Center for Poverty and added some things. And one thing we thought to really clarify is that children whose home language is other than English in itself isn't the risk factor. The family's inability to communicate with the educators or informal support, in fact, is the risk, because we really wanted to be clear that we would support children and their families to maintain their home language. But this definition helped us in talking to other state agencies and partnering. It gave us a space to talk about military families who may, in fact, be at risk with the several wards we were in at the time and the disaggregation of military families in our state as an example. It really strengthened our relationship, work we were doing in housing and with homeless families and in shelters, to the point that they were doing screenings eventually of the children. It gave them some other way to think than the children were in the way and the parents were supposed to be looking for housing. We also, through our Child Care Development Block Grant Fund, prior to Race to the Top, had always labeled some priority populations. And these are categories of families, homeless, teen parents, children in the child welfare system, that we knew at least they had one risk factor, homeless, maybe economic, or at least disruption of housing, teen parents because they're young, and disruption of education, and being in the child welfare system for a variety of reasons. We knew they were entering with at least one risk factor. So we created agreements with state agencies, especially the Department of Children and Families, around the housing with the Department of Housing and Community Development, so that they're responsible for the screening and the identification of families that would be eligible for child care services. And we had contracts with our child care providers and gave them a specific add-on so that they would do additional services and they would pay attention to these families in different ways. And we created in our universal preschool program to overdo Race to the Top period, a broader definition that really said, even though we're doing universal preschool, we want you to identify the 5 children in your classroom who you believe to be most at risk, and that's the way we would fund. We would do an add-on or a grant using that definition, so that we were all looking for those children, making sure we would individualize using our screening and formative assessment to make judgments and provide support. When we thought about our contracts, we had specific things that we asked for that were over and above what was required, of course, in licensing because of the contract and because of the add-on. Transportation, which can be very controversial, was a part of it and was controversial. Individualized plans and going to the other agency and determining what housing or what child welfare was doing with the child in the family, making sure there were comprehensive services that families were connected to are examples. Parenting, nurturing, and support was also a part of those services. You can see the others that are on the list. And I want to point out that as we did work with other agencies, it became clear that this framework around two-generation strategies is critical, and looking at how the state agency is thinking about the family. Many agencies, such as housing, will offer a family shelter, and in fact, sometimes single men have a harder time. And so but we know they enter because there's a parent-child, and then they often focus on the parent in terms of getting the housing. And so this frame was helpful in working with other state agencies to say we really want everybody to be about whole family approaches, but we respect where you are. And in fact, the child-serving agencies often focus on the child versus focusing on the family. And this comes from an Ascend report that's much longer, that if you wanted more information, you should seek. So key concepts and kind of thoughts from Massachusetts. Screening, as I said earlier, is critical to ID and potential developmental delays. It's about many and varied learning opportunities. Many of our families in shelters may not have been ready for formal child care as they were getting ready for a move, and that might disrupt the protected relationships we want to create for the child, although sometimes they were going to be there long enough to make that make sense. We worked with our libraries and museums so that they were sensitized to working with families. Formative assessments are critical in formal programs so that you're really identifying where the child is, talking to the family about what they can do to support their growth and development. Intentional curriculum design to developmental delays. I've talked about two-generation.
Sherri, did we lose you? I think, Sherri, if you're...
I'm going to, and I talked with Sherri about this, and one of the things that she really wanted to emphasize in this is that when we're talking about quality rating and improvement systems, when we're talking about expanding the child care workforce, when we're talking about developing data systems, we've still got to keep an eye towards those two-generation strategies, and really the ways that we make sure that what we're doing do reflect upon positively on strengthening those relationships is really important. I want to go back to that. And that one of the strengths of really focusing in this way is that you really do engage the necessary collaboration to address the whole child, family, and community across agencies. And while a very small percentage of kids are in the Child Protective Service system, they're exceedingly important kids, and their development is exceedingly important, and one has to be able to respond effectively to them. And when there are kids in housing, public housing, we want to make sure that those public housing environments are family-friendly as well. And is Sherri back on?
Yes, I am. Thank
you.
But thanks for covering that. Sorry for getting kicked out.
Sherri, any final comments from you around your...
Well, I think Charlie covered it. I'm not sure when I got kicked out. I would add that it's not just public housing, but the shelters also in the communities, transitional housing need support as well. But the interagency collaboration is critical, and this is the definition provides a door in and then provides a platform for cross-training and screening and professional development.
Absolutely. Thank you so much, Sherri. I'm glad you got back on. All right, so now what we are going to do is first we're going to invite Miriam to comment on the last section, as well as any other comments she has around high needs children and the Race to the Top application. And then we're going to open it up for comments, questions to all of you. So again, feel free to either raise your hand on the top left-hand corner, enter a question in the bottom left-hand corner, or when I announce that we're ready, you can star 7, unmute yourself, and ask a question then. But Miriam?
Thank you. So just a few comments. I think I'll underscore some of the things that have been said. In thinking about going back to the question about earlier that has been asked about strategies and wanting, a desire to hear more about successful strategies, just to underscore again that some of the most successful applications in round one really successfully used place-based strategies. And I think in exactly the ways that Charlie was discussing and suggesting, looking at communities and geographic areas where there were particular high vulnerabilities, and then focusing and targeting resources within those communities and those different names in different sections of the application, zones to really, or high needs area zones, to really employ many of these multi-generation strategies, dual generation strategies, efforts to improve the quality of early learning and development programs serving those children. And so the place-based strategies is probably I think a great way to continue to think about this in your state as you have, and that you have access to some of that information to be able to identify those areas of vulnerability where young children are concentrated. I think the other point that I want to mention is related to sort of the evidence that you have available to you about the interventions that you're proposing and whether those will be effective for the children with high needs or the special populations of children that are outlined in the definition. And, looking back on some of the successful applications, again, I think not assuming that sort of new approaches or new interventions or new quality improvement strategies or issues around assessment or even that your standards have fully addressed all of these populations and in the way that they need to, and being very explicit as you describe and talk about these strategies as things that you know and understand, whether because you've been collecting that data yourself or because there's evidence to back it up that some of those strategies will be effective for those special populations of children or children with high needs as you talk about them in your state. And then the last point is to, as I'm sure many of you are aware and thinking about, one of the changes between the application in the first round and this round is the requirement that participation in early learning and development programs be disaggregated by race and ethnicity. And my view of this is that, again, this is a higher bar in the sense that talking and focusing many of your strategies for high needs kids is to be able to say we're going to be focused on improving the quality of our early learning and development programs in the ways that we know, with the metrics that we have and the inputs that we measure to around quality. May continue to be effective, but may not be sufficient, particularly if you have, as you start to outline in this table, pockets of children who are not participating. And I think that while you can talk about some of those access challenges and what you'll be doing about that, some strategies to think about there is again, to build out other types of programs or services in your state that you think are touching these children more directly, or to talk about it in other sections of the application. As sort of Sherri has talked about previously, how are you leveraging the healthcare system that is interfacing with these children? How are you using family engagement strategies or other sectors, other parts of your system in your state to be able to reach these families. So again, thinking just to close on that point, we know that there continue to be access gaps for certain groups of kids, and some of those, could as well present themselves as rural challenges or challenges that are specific to race and ethnicity. And so as you think about, I think this is an important place to address whether or not you feel like you're capturing those children in these early learning and development programs, and if you are, what intentionality are you bringing throughout the, to improve upon those services. But if you're not capturing them or missing certain subgroups, how are you addressing that in other areas of your application? So I see this as a bit more sort of accountability for understanding where these kids are, specifically children of diverse racial and ethnic backgrounds in your state in terms of what services they're currently getting. Sherri and Charlie, if you agree with that.
Yeah, that's right. And I want to give a couple concrete examples. I'm glad Miriam raised the evidence point. So we had a really strong statewide family engagement strategy, but there were two ways that as we defined high risk, and we got all of them using the ASQ to screen and determine where children were, we added two things. One, they had to use evidence-based literacy practices. And here, before that, they all did things around literacy. They had story walks, they had story time, they had groups, but the practice wasn't necessarily one that was scaffolded or built or targeted for high needs children. And so we invested a lot in making sure that across the board that was the case. The second was, because we were focused on children birth to 3, we trained everyone using Brazil Touchpoints, and not just our family engagement grantees, but they had to bring a partner from the community so that we would have a more focused, research-based intervention around children birth to 3. So two concrete examples that once you identify who you were targeting and you found that through a way of screening, then your efforts needed to also be evidence-based so that you could seek the results you wanted.
Thank you very much. I think now we're going to open it up for comments and questions from the participants. We do have one question that I'm going to read, and then I welcome others to also ask their questions. Raising housing issues and vulnerable environments reminds me to ask if any presenters want to comment on the impact of violence, community and or domestic.
Yeah, I certainly will. I mean, and I think they indicated, if you look at the research literature, that toxic stress that comes from a variety of sources, and the absence of protective factors and the presence of violence in the home when children are young is clearly detrimental and harmful to kids, educationally, socially, emotionally, developmentally. And so that is certainly something that you could say we have a special concern around addressing and responding to that as another high needs population. I also think that short of violence, it's how can we support and strengthen families which may simply be pretty stressed to the max and struggling with their day-to-day lives. But certainly don't want to leave out that as a hugely vulnerable population.
Absolutely. All right, now I'm going to open it up. Please hit *7 to unmute yourself and ask questions of our presenters. While people are thinking of their questions, I just wondered if any of you had any further wrap-up comments for the end of the session. Oh, and we did have a question around whether copies of the slides will be available after this session. If you have registered for the webinar, you'll get an email, and the presentation will be attached to that email. It'll also be available on the ELCC website.
I'm almost wondering if it would be interesting to do the poll again. I don't think we have the technology capacity to do that, but is anybody on the call kind of interested in maybe sharing some reflections of what they've heard that's made them change sort of from thinking about a new strategy around defining children with high needs and incorporating them into their plans.
This is Tom Rendon. Can you hear me?
Yes,
yeah.
We hear you, Tom.
It's from Iowa, and I must say the part that I found really interesting was the specific suggestions from Massachusetts.
Mm-hmm.
I think there's sort of two big parts of this webinar that I found really useful. One is to really think very broadly and in a more sophisticated manner on what do we mean by high needs, and I think that's a lot of what we heard in the beginning. But I think part of what we're struggling with a lot is how do we really do that? How do we make sure that all the plans have this edge to them that really is about identification, targeting, and then assuring that those children are have access to high quality programs. And there's this almost a paradox which I saw in Massachusetts presentation, and that is the whole notion of targeting high needs children is almost the opposite of anything that you might do universally or make universally available. And yet at the same time, it is often our universal applications, especially of screening, which help us identify what those high needs kids are. So I think it's really that universal and the specific effort that starts to make, that allows you to say all children need support at some level, but they all don't need the same kinds of support. So how do you, and this is maybe probably the wrong word, but how do you kind of triage that so that you get the kids with the absolute most needs the greatest amount of services, relative, and those with several, maybe intermediate level needs to get their needs met. And it's trying to right size all that, because I think part of what's happened, and I think Charlie pointed this out with Neil's slide, about how we may be really good at reaching the both ends, but it's these people that are kind of in the middle, maybe they're at 175% of poverty, they're still struggling economically, they don't qualify for Head Start, but they still may have all of those issues and needs. How do they get identified and targeted and still put into, and still get their needs addressed in the system? So I thought Massachusetts had a lot of really good ideas about that.
And Tom, let me just give you one more good idea. I thought when I was there, that's exciting about the pre-K to third grade link. I got a superintendent excited about screening, and so she was doing more intensive screening. She also had the family engagement grant. And so you worry she's going to come back and say all these kids need early education and care. But through her screening, she discovered there were 15 children, only 15, in a big community that didn't have access either to her public preschool or child care already or some other resource. And so if you use that universal to narrow approach and you work with your partners around understanding your definition, you often really do get a problem you can solve. And what we were trying to create for them is child care now or a summer-only opportunity, and how did we do both of those things so that these children who we knew were delayed. And the KEA was used in kindergarten, and out of kindergarten came a small group of kids that, despite using the formative assessment, were not going to be on target if we didn't do support to get them to first grade. So both the universal screening of the 3- and 4-year-olds and then using the KEA, both with this superintendent, created small numbers of kids who needed additional support who might not otherwise gotten it.
Thank you. Thank you very much for both of your comments. I think we're going to move on to the next slide. It's a disclaimer, and Charlie's going to talk briefly about what Early Learning Challenge Collaborative is able to do around the high needs conversation and the race to the top.
Well, thank you, Michelle. And I wanted these slides to look like a cigarette package, but they don't. But it's really a warning. I mean, that the Early Learning Challenge Collaborative has not determined that taking a an approach and really focusing on it throughout your application is necessarily going to score you more points. And certainly there are some of you probably who are already in midstream writing an application and saying, I don't want to start over. And we're not necessarily recommending that. I would say from my experience reading applications, I found I got most excited reading when someone started to get into one of these areas and saying, you know, under this proposal, we really plan to do this, and we really hope to get at this population of kids. And that's when a lot of the proposals took on more life. But you are writing to the test. You are writing to the different point totals, and some of them are necessarily around data systems, which I've tried my hardest to write things that are interesting, and it's sometimes a challenge. But anyway, the kind of the caution or the warning is that what we're presenting is, we think, good food for thought, and it may be something some of you want to do, but not necessarily all of you, and we're not claiming that this is the way to get your application approved. Saying that, the offer is, and I think that the ELCC is providing different forms of technical assistance in different areas, including individualized consultative sessions and select development of state-specific data for states. And maybe in response to Miriam's question, if you get back to Jerry Cobb and the folks at the Early Learning Challenge Collaborative and say, we'd like to pursue this further, there is at least an offer to do that more on a one-on-one basis. And some of the slides that are presented here and some of the data presented here is also available, and even more data around certain types of breakouts by race, language, culture, and socioeconomic status that's available on a state level that is not required to complete in your innumerable tables that you have to complete, but that also could be woven in to your discussion. So that's really the offer we're providing, and we're also providing other webinars, as you know, and so I just want to turn it back over to Michelle for that.
Sure. Thanks, Shirley. And first, I want to thank all of our presenters, Miriam, Sherri, and Charlie. Really great insights and a great kind of new, in some degree, way of thinking about the high needs focus, and then the concrete thinking around what works in Massachusetts and input into other states and their thinking around this application have been, I think, really helpful. So I want to thank all three of you. We also just wanted to mention a few things on behalf of the Early Learning Challenge Collaborative, and there's many opportunities for the collaborative to provide support to states around many sections of the application. The Early Learning Challenge Collaborative has raised some private funds to support your application preparation. For some states, they've had reviewers look at the Round 1 application to give some advice about what they see as strengths and weaknesses and analyze the federal reviewers' thoughts as well. The ELCC can also match your state with other kinds of reviewers. For example, we may want a QRIS assessment or data expert to read a section of your application and provide some advice. There's other types of tailored technical assistance that can be offered as well. So if you seek support, please feel free to contact Susan Hibbard. Her email is on the slide that is up right now. There's also a series of webinars, and I'm going to mention two that are coming up really quickly. Tomorrow at 2 o'clock Eastern, there is a webinar in the QRIS conversation in relation to the Race to the Top Early Learning Challenge. And then on Friday the 13th, there's one around Early Learning Challenge and the pre-K to 3 discussion. Both of those are intended to support states who are applying for Race to the Top. There's also other webinars that are coming up next week, and those are all listed on the Early Learning Challenge website, which is linked on the slide in front of you. Last, ELCC is interested in facilitating cross-state collaborations that you think would support better systems efforts. So if you're interested in finding other states that might want to collaborate on something, please let us know that as well. And again, Susan's contact information is in front of you. And they will help work to identify potential state partners if we can. So first of all, congratulations to all of you for all your hard work that you're doing now and you'll continue to do around this work. And thank you so much, all of our presenters and all of our participants. Thank you so much, and have a good evening.
Thank you.
Thank you.
Thank you. Please stand by.